நீங்க எப்படி எடுத்துக்கலாம் எதுவுமே எடுத்துக்கலாம் அம்மா மட்டும் எடுத்துக்கலாம்
ஆல்ரெடி செட்டப் பண்ணிட்டு இருந்தோம். இதா மெலோடி ஸ்கிரீன் மாத்திரம் மெலோடி ஸ்கிரீன் కొంచెం ఎత్తాలా ఇప్పుడు ఇప్పుడు ஹலோ அதுக்கு யாரும் தொடர்பு மேபி லேட் பிக்கப் ஆகுறாங்க என்ட்ரன்ஸ் கரெக்டாக செக் பண்ணு அந்த மேபி அந்த பிக்கப் லேட் பிக்கப் என்ன கிடைக்குமோ அதனால நமக்கு அப்படி தெரியும் இப்போ யாரும் எதுவும் கம்ப்ளைண்ட் சொல்லல
இல்ல இது இன்னும் கொஞ்சம் ஹைட் பண்ணாக்கா
ஒரு டெமோ பண்ணுறீங்களா? சரி மேடம் இப்போ பேசுவாங்க கேள்வி போட்டு சூர்யா தான்.
ஹாய் சூர்யா. சூர்யா வாங்க. கேக்குதா? கேக்குதா பேசுறது? சூர்யா கேக்குதா?
கேக்குது. சொல்லிட்டு இருக்கேன் பட் அங்க இருந்து செட்டப்.
ஓகே ஓகே ஃபைன். அது இவ்ளோ என்ன சொல்றது? அந்த லவுட்ல தான் பேச முடியும். இது இன்னும் லவுடா பேச முடியாது.
இது கரெக்ட்டா. சூர்யா நீ மைக் பேசுங்க.
சூர்யா சாப்பிட்டீங்களா? இன்னைக்கு வர மாட்டேன்னு சொல்லாமலே போயிட்டீங்க நேத்து. சொல்லிட்டு போனது தானே.
என்ன சொன்னாங்க சொல்லு?
என்ன சொன்னாங்க சொல்லு. எப்படி பையன் சொன்னேன்.
சரி சரி ஓகே. கேமரா ஆஃப் பண்ணி வச்சுக்கோ. கேமராவும் வாய்ஸும் மியூட்டும்.
Hi, welcome you all for the baby nursing program. My name is Manju. I'm working in Cloud9 Jayanagar as a nursing in charge. She's Sister Sheila. She's working as a pediatric nurse past almost 14 years of Cloud9 experience. She's working as a pediatric nurse. So once again, welcome you all for the baby nursing program. So today we are going to discuss about the baby things, like how to take care of the newborn babies, how to give the bath, how to wrap the baby, how to burp the baby, how to uh, give the diaper change, means how to change the diaper. So there are so many things, especially for the new mothers, those are going for first time delivery mothers, for are already delivered mothers. So how to take care of the baby, those are worrying. So definitely, I hope this class will be definitely helpful for you people. So any doubt, anything, please put it in the chat box. We'll answer later. So we'll get in that. Okay, good. So first we'll discuss about the bath. So bath, in the sense, there are two kind of bath. One is traditional bath and tub bath. Traditional bath in the sense, like everybody knows, our elder people, they used to sit in the floors, they used to go give bath in the leg, right? So that is called traditional bath. The traditional bath, there is advantage and disadvantage. Okay, I'll explain everything, but which is your comfortable, which is like convenient for you people, definitely you can select. Okay, so traditional bath advantage in the sense, you should have elder people at home, basically. Then only you can perform that kind of bath, because of you should have means familiar to give bath, or you should have practice to give bath, that kind of traditional bath, right? So otherwise, what will happen if you giving, while giving bath, you may leave the baby in between legs. So that's why you have to make sure you should have elder people at home. Those are already aware of that bath, how to give, right? So that is very important. So disadvantage in the sense, what will happen while giving bath, they'll pour a lot of hot water on the baby. That is delicate skin, newborn's baby, right? They put a lot of hot water on the baby. They'll pull the legs and the hands. They'll squeeze the nipple. Because of the prolonged bath, baby will get dehydrated and baby will sleep for longer period. Basically, in initial days, especially 2 weeks of the age of the life of the baby, you have to feed your baby more frequently. If you're giving that kind of royal bath, what will happen? Baby will sleep for longer period. Baby will not get up early or demand for the feedings. Okay, or when you try to wake up the baby, also baby will not get up basically. Because of the bath, baby can sleep for longer period. Because the baby got tired, right? So baby will sleep for longer period. So frequent feed will not happening if you're giving like traditional bath in initial stage. It's good, better to give traditional bath after 15 days later. Okay, even we too recommend, but it's little bit later. Okay, not in initial days. Okay, that is a disadvantage. Advantage, as I said, you should have elder people at home. Those are aware to give bath. Okay, so that is the advantage and disadvantage about the traditional bath. So we'll talk about the tub bath. Okay, tub bath, this is a tub. So once you deliver or when you're going to deliver, this kind of bath will be kept in your, will be given to you if you offer for this bath. Means tub will give you. So in the hospital also will be preferably will give this kind of bath only. This kind of bath, it's very easy to give. Okay, it's very easy. So anybody can give bath, like as a pediatric nurse, as a working in the bedside nurse, or hospital setup we used to give. If you go to home also, anybody can perform this kind of bath, as a mother, as a parenting, or father-in-law, means mother-in-law, or anybody, people's like younger people, they also can be give this kind of bath. It's very easy to give bath. So as I mentioned, this advantage in the sense, it's very easy to give bath. It's very quick bath. Okay, it's comfortable for the baby also. Okay, disadvantage in the sense, it may get slippery because of we are holding the baby in this, right? So because of the baby having vernix in the body, vernix in the sense, it's kind of creamy things in the body. Babies after the birth, that like in the newborn period, that vernix will be in the body. You should not basically completely remove. That can be protect your baby temperature. So usually we won't remove completely. So that vernix, if you dip into the water, what will happen? That means slippery into the water. So that is the reason we won't. That is a disadvantage in the tub bath actually. So when you giving the bath, you have to make sure you have to hold the baby properly. So that is the advantage and disadvantage for the bathing. Okay, so I hope you understand traditional bath and tub bath, advantage and disadvantage, both we have explained, which is your convenient or which is your preferring according to your baby. Definitely you can do this. Okay, so before going for the bath, we have to make sure all the things should be kept ready, then only you can perform that bath. So if you're sitting for the bath for everything, if you're running for that, then it will be quite not comfortable to give the bath. So make sure you have to keep all the things ready then you have to perform the bath. Make sure when you're keeping things ready also, baby should be always with attendant. Without attendant, baby should not leave that. Okay. So what and all, basically you have to keep the things ready for before bathing. In the sense, you should have keep cotton balls. Cotton balls, I'll tell you why to keep. Okay, cotton balls you should keep, and alcohol swab. Okay, cotton balls and alcohol swab, and wet wipes, whichever your company is using wet wipes, and baby solution, bath solution, and diaper, and clean cloth, two cloth. One is for wiping, one is for wrapping. So two cloth and one dress. Okay, these all things you should keep ready. Then if you're giving, suppose tub bath means you have to fill in the water in the tub. 3/4 of the water means tub means water you should fill. You have to check the temperature also before giving the bath. Okay. Then in your mug means jug or your mug, you have to keep the lukewarm water. It should not be too hot. It should not be too cold. Also, it should be kind of lukewarm water for the suitable for the baby skin. Okay. These are the things you should keep ready before the bathing. So now we'll see how to perform the bath. So while performing the bath, before, as I mentioned, before performing the bath, you have to check the water temperature. Okay. So basically, how you check the water temperature in the sense you have to, in your elbow, you have to just touch and see like that. Okay. It should not be too it should not be too cold or it should not be too warm. It should be kind of lukewarm water. It should be preferably should out for the baby skin. Okay. So these are the things you should keep ready. So once you check the temperature of the water, slowly take the baby in your hand. Slowly take the baby in your hand, put into the water. Slowly you have to keep actually. So before baby keeps, you have to clean the baby eyes. So how you are going to clean the baby eyes in the sense? I think so you have kept already the cotton bottle ball, right? Okay. So cotton bottle ball, dip into the water, clean the baby eyes, inner to outer. I think so you can follow her, right? So you have to clean the baby eyes, inner to outer. Yeah, inner to outer. If you feel again the eyes is not clean, it's still dirty, take one more cotton bottle, you can clean the baby eyes, inner to outer. Yeah. So if you want to clean another eyes, you have to take fresh cotton ball, one more cotton ball, you have to dip into the water and clean the baby eyes. The same cotton ball, you cannot use both eyes. Suppose what will happen if you cleaning like that, might be one eyes will not be infections. Okay. So if you same cotton ball, if you use it to another eyes, what will happen? You are introducing the infection to which is not infected also, right? So make sure you have to clean both the eyes, single cotton ball. So once the eyes is clean, you have to dip in your hand into water. Just wipe the face. Okay. So once the wipe is face, you have to give the complete body bath. So you can put little solution in the bath itself. Okay, whichever your solution you are using, just mix it in the water itself. No need of using soaping for initial days. So whatever bathing solution is more than enough. Okay. So slowly put the baby into the water. Once the baby gets adapted into the water, kind of leg can be put into the water. Once the baby gets adapted into the water, quickly pour the baby water on the all over the baby means body. Make sure you have to underarm and groin area, everywhere should be cleaned well. So once the front part cleaned, slowly turn the baby towards back side. Hold the baby in your neck, like front neck, right? Definitely it's not going to hurt the baby. Definitely you can hold arms actually. You can hold the baby like that. Forefinger is on one side, and thumb finger in the another side. You can just hold like that. It's definitely not going to hurt. Okay, hold like that, and you can backside also pour the water and just clean it well. Okay, so your bath, baby bath, body bath is over. Still head bath is pending. So you can take to the table and just wrap it well. Wrap it in the sense, just you can quickly wipe it and just take in the take that itself, means wrapper itself. Now we are going to give the head bath. How you are going to give head bath in the sense? Yeah, while holding, so make sure you have to hold the neck. Forefinger is one side, another thumb finger is one side, right? While holding, you have to cover the ears. Your thumb and might be center finger. You can cover the ears. Okay, just you can, because this can be folded right. Your pinna can be folded right. Just fold and keep like that also. Or if you cover like that also, it's fine. But basically, you have to cover the ear and just pour the water on the head. Make sure baby head is also clean. So whatever you have kept extra water in your mouth, that can be poured onto the baby head. Definitely, again, this is also not going to water not get into the ear because you have covered the ears. Definitely, it's not going to hurt to the baby. So your baby bath is done now. So quickly you can just wipe it the baby well, okay? Because your bath is everything ready, okay? So head bath, eye clean, body bath, face, everything is clean. So after the baby bath, basically you have to supposed to clean the umbilical cord of the baby, okay? Basically this umbilical cord will fall out within 7 days or within 10 days definitely it will be fall. Basically it will take 7 to 10 days to fall. So after bath it will be wet, right? You have to make sure it should be clean and dry. Always you have to make sure it should be clean and dry. It should not be wet. It should not be very moisturized. It should be always keep clean and dry. Then only that healing will be fast and it will be fall fast also. Okay. So how you are going to clean? You have to clean. Take the alcohol swab. So initially we have said right preparation. What are the things you should keep ready? In that you have to part of alcohol swab also to keep the umbilical cord. Okay. You open the alcohol swab and clean the umbilical cord one stroke, like circular motion. Okay, just one stroke you have to clean. When you feel it's kind of little discharge, like kind of water discharge, kind of any might be light, not first actually, it's kind of discharge. You can clean with alcohol swab. You can make it dry. When you feel it's kind of bloody discharge, kind of other discharge with a smelly discharge, you have to notify your pediatricians immediately. Okay, I hope you understand about the bathing. Okay, now we'll talk about the diaper things. Okay, so when we come to diaper, like the lot of diaper is available in the market, kind of disposable diaper. Disposable diaper also there are so many varieties are available, kind of strap things or else kind of panting things. So whichever you are comfortable, definitely you can adopt. Okay, so before going for the diaper change, we'll talk about the diaper things little bit. Okay, diaper also there are two kind of diaper. One is cloth diaper and disposable diaper. Disposable diaper in the sense as what we are using right now. Okay, this is called a disposable diaper. In this diaper, there are strap things and panty kind of things also it's available. I'll just tell about advantage and disadvantage. Advantage in the sense, might be it's very hygienic, it's very neat when some baby put into the diaper like that. See how it looks actually. So it's very hygienic and it's clean also. Baby will feel comfortable. Baby will sleep for a longer period if you put the diaper. What will happen? Baby pass urine also. Baby will not feel that it's wetness. Okay, so baby will not get basically the irritant. So baby can sleep for the some more longer period. So that is the advantage. Disadvantage in the sense baby diaper rash can be appearance. Okay, because of it's a tight or there is no air ventilations. There is no okay. So might be it can be diaper rash also can be come or we are increasing lot of environmental waste, right? So imagine per day baby is passing 10 times, 5-6 times urine, on 5-6 times motion. Imagine more than 10 we are increasing the diaper waste, right? So environmental waste. So imagine per day it's a 10 or 15. So imagine for 1 month how many. So that is generating the lot of environmental waste. So this is about disadvantage. So advantage, as we have mentioned, it's very hygienic and comfortable. Baby can sleep for longer period. Disadvantage, one more thing, in this we cannot able to count how many times baby passed urine or how many times baby passed motion. Why? In the sense baby passed very little quantity of the urine. In the very little quantity of the urine that may be observed in the diaper itself. As in might be you people cannot able to make out whether the baby passed urine or not. You can just imagine that telling that, oh, my baby is not passing urine 4 hour, 5 hour over, still not passing like that. As a medical field, we may able to recognize that whether the baby passed or not. Because there is a little color changes will be happen. The weight also will not increase the diaper because a very less quantity baby will pass, right? So that may be a disadvantage. So when it comes to the cloth diaper in the sense it has olden days everybody used to cut the cloth itself, cotton cloth preferably. They'll cut a triangle shape, they'll use as a diaper, right? That is also it's preferably can be used. I'll just tell about that advantage and disadvantage. Advantage in the sense when you're using for cloth diaper, you can be able to count that how many times baby passed urine or how many times baby passed motion in a day, right? It's very easy to count. Input actually means output. So based on that, you can imagine that whether baby had enough milk or not. Okay, so it's very easy to count. Disadvantage in the sense you should have somebody to clean, you should have somebody to wash, iron, holding and keeping, drying. There are a lot of like manpower you need to do that. So that is a disadvantage. Otherwise, it's quite difficult when you're putting for that baby to cloth diaper to the for the baby. Once a baby pass urine or motion, baby will not sleep for longer period in that. Baby will get little irritated or disturbance sleeping basically. Okay, so that is a disadvantage. Okay, otherwise advantages you can count the pee count, poo count, how many times baby passed urine. So I discussed about the cloth diaper and as well as the disposable diaper about the advantage and disadvantage. I hope you understand both. So which is convenient for you, definitely you can adopt that. Okay. So we'll see the practical how to change the diaper now. Okay, good. So when this baby already put the diaper, we'll see how to change the diaper, like how to remove the diaper, how to clean the soiled diaper. Okay. So this is a strap things what you are using now. We remove the strap. Okay, it's a sticky kind of thing. Okay, it's a kind of velcro things. Remove the velcro, the strap things, and stick it on the same side because we should stick it. If not stick it, what will happen? It will be touched to the baby skin. I'll show that side. Yes, you can be able to see. Okay, so remove the strap and stuck it on the same side. Yeah, remove the strap and stuck it on the same side. If you're not stucking, what will happen? It will be touching to the skin. The velcro can peel to the baby's skin. So make sure it should be touched. Then lift the baby leg. Just whatever baby passed urine or maybe motion, imagine that baby passed motion. Just clean in that upper to and top to down. You have to clean and tuck it in the down itself. Okay, just tuck it. Take a wet wipes. Take your wet wipes and clean top to down. Yeah. Basically, whether female child or male child, okay, you have to clean the diaper. When you're cleaning, it should be top to down. It's top to bottom. It should not be from bottom to top. If why we have to basically clean for a female child, we have to top to bottom in the sense because of fecal matter can get into the private parts like kind of genital areas. Okay, that can be leading to infections. So you have to make sure you have to clean one stroke top to down. If you want to clean it means take first one, take top to down. Yeah. Once the baby diaper is clean, so we'll see how to put the fresh diaper. Open the strap. This means strap thing should become baby backside basically. Okay. So open strap nicely. So according to the baby weight, okay, you can get the diaper size, small size, medium size, or XL size like that. Okay. So open the strap and keep the straps thing should become baby bottom side. Okay, down side. Okay. Then down part just cover it to the umbilical and open the strap and stick it. Yeah, open the strap and stick it. That's all. So once the baby diaper is done, so baby can be fit and well. It should not be too tight or it should not be too loose. It should be quite fit. Okay, it should be very quite fit. See, okay, if it is too loose, what will happen? The fecal matter can be leak out or the diaper can wet. If too tight, the circulation or rashes may appear. Okay, so make sure it should not be too loose or it should not be too tight. It should be fit and well. Okay, according to the baby, as I mentioned, according to baby weight, you can buy your diaper. Good. So we'll discuss about the diaper things also. Okay. Now we are going to see how to wrap the baby. Okay. This is most of the people, like most of the mothers are worrying how to wrap the baby, like how to take care of the baby because of the initial days you're supposed to wrap the baby always and keep because of then only you can maintain the temperature of the baby body. Okay. So that is the reason you have to make sure you have to wrap well and keep. Basically, mother wears one dress means baby should be wearing two dress. Or mother wearing two dress means basically baby should wear top of that one extra, like three dress like that, including the wrapper. So that is why wrapper is also it's very important too because the extremities always the gloves and socks will not be there. No? When the babies start moving the hands, that may leave that means fall that. So if you wrap and keep, babies also feels comfortable. They'll feel that still they're in the comfort zone. They'll sleep for a longer period. They'll not get disturbance. Okay. It's really good to maintain the temperature also. So how to wrap the baby, we'll see. So for the wrapping things, preferably always use cotton things. Okay, it should be square type. Okay, it's not triangle shape and all, it's not come properly. Basically, you have to take square one. Okay, so take square one, spread over the flat surface. Any one side, any corner of one side, you have to you have to fold. I think so. You can be able to follow us. Yeah, any one side, you have to just little fold. Take the baby and keep your whichever side you are folded. Okay, head should be keep over there, and any one side. As of now, we are taking from the right side. Okay, any one side, take that whichever side you are folded right there. I'm talking. Take and cover to the ear and keep until the chest. Hand should be keep opposite side. Baby hand right side. If you are covering started to covering means hand should be keep opposite side. The same side you have to take the right hand and tuck it over to the left side. Means left side you have to keep bottom also if it is extra cloth. Okay, so it can be tuck it to the baby down. Yeah. Second things you have to take from the foot and leg. Head means foots can be folded also because a baby was in the womb like that only. No, baby was like that, right? So folded leg also it's good and fine only. It's there. You do not think that like baby can hurt. Definitely it's not. Okay, you can just fold the legs. Okay, keep until to the chest. Okay, then that is the second steps. Third steps, the opposite ears, right? Head end. You can take left side. You can cover it to the up to the ear and keep to the till the chest. Left hand can keep the opposite side, like can be folded like that. Okay, in the left hand side, you can take the wrapper sheet, tuck it with the opposite side, like the right side. Tuck it and extra cloth, whatever it's at, you can keep the back side only, like tuck over back of the baby. So if you wrap and keep like that, you see your baby will be so comfortable. Baby feel that still there in the mama womb. They'll not feel that. Okay, so baby can sleep for at least 2 or 3 hours, right? So it's really good. Always keep the baby to wrap, right? So those are holding the baby to like first time, second time, means first time also they're not very scared to hold the baby. They feel they will be comfortable to hold the baby, right? So I hope you understand that. Okay, we'll go for burping. So burping is another part. It's very important. You have to burp the baby after every feed. It's very must. Okay. So how to hold the baby for burping in the sense you have to hold the baby underarm. Yeah, underarm. Put the baby on your shoulder. Yeah. Baby tummy should compress on your shoulder. Baby tummy should compress on your shoulder. Yeah. Keep your face towards your baby like that. Your face should be towards the baby. Okay. Nicely tap or rub. Tap or rub, anything is fine. It's like less than 5 minutes is enough. 2 to 4 minutes, 2 to 5 minutes it's enough. You can just tap or rub. Every time baby cannot make the whoop sound, that burping sound cannot be happen because of sometimes they pass gas down also. Okay, both is acceptable, but don't wait for the whoop sound. But still, you have to do the procedure. Okay, each after feed you have to do that. It's very must. What will happen if you not do? Baby, while sucking the milk, baby can keep the milk in the mouth itself. If you're not burping, okay, when you're putting the burping, what will happen? The extra milk can be come out to the out or can be swallowed back. Or if you're not burping, what will happen? The baby will keep the milk in the mouth itself. When you're putting baby in the down, that the baby can try to swallow that. Then that can be milk can be entered into the lungs, or that can be leading to any other complications. So we don't want to get our baby to get into back like that. So you have to must doing the burping procedure. Okay, good. So we'll come to the end of that. So how to hold the baby, right? Holding also there is a lot of position is there to hold the baby. Okay, so this is called chest to chest, like kangaroo mother cat. It's very good position to hold the baby. It's very nice. Baby feel that so comfort because of baby in the whatever the amniotic fluid smell, that's the same smell coming to your breast. If you're keeping like that, baby can smell that. So baby think that, oh, I'm not gone anywhere, I'm in still my mama home. So baby can think that I'm in safe hand or safe zone. Okay. So it's very good question. Baby increase the weight more, baby infection will be reduced. It's called KFC basically. Father also can be given, it's called KFC. Okay, it's kangaroo mother care or kangaroo father care can be given. Okay. So when you give like that, it can be bare chest. Baby put it under, it's between the chest. baby face should be in one side. Okay. Then you can just tuck it to any dupatta or like any kind of things. Okay. You can tuck it well. You can sleep for at least 1 hour or 2 hours. You can take give the chemistry to the baby. Okay, so it's called a chest to chest or kangaroo mother cat. Okay, one more question. It's called a hold cradle hold. Yeah, this is way of a traditional way of holding. It's called a cradle hold. This is also very comfortable position. You have to support the baby in your arm. Support the baby in your arm. Baby like buttock should be you should be supported with your okay. You should support like that. It's a way of traditional holding. It's a called a cradle hold. Okay, there are so many holding position also it's there. So this is the main position to hold. Okay, it's very comfortable. Okay, so basically we are almost come to the end of the session. I understand. I hope that you all understand the session. I'll just summarize what all we discussed till now. Okay, so initially we have talked about the baby bath, tub bath, and traditional bath. We have discussed what is advantage, what is disadvantage for the both. Okay, then we have seen what are all things we need to prepare for the bathing, what are all things we need to keep before the bathing. Then we see procedure like how to perform the bath. Okay, so basically you have to clean with the high care. Okay, then face, body, and head and the cord care we have seen. Okay, I hope you all are step by step you can do. Then we have come with the diaper change. Diaper change also we discussed the two things. One is cloth diaper and disposable diaper. Okay, both we have understand. We have seen what is advantage and disadvantage. Whichever you are comfortable, whichever you are convenient for your baby. Once your situation, definitely you can adopt. Okay. Then we have seen how to put the fresh diaper, how to change the soiled diaper. That is also we have discussed. Then we have come to that like how to wrap the baby. Okay. Then how to hold the baby, how to burp the baby. So these are the things we have discussed in the session today. I hope you all understand. Please stay on the line. Ms. Mohana Priya also is a physiotherapist on the line. She will explain about the baby massage and other things. Thank you for the your understanding. If any doubt or anything, please put in the chat box. We'll answer that. Thank you.
Hi everyone. So I'm just starting this session now. I'm Mohana Priya from Cloud9 Hospital. So today I'm going to talk about baby massage. So actually previously you saw the how to wrap the baby, how to change the diaper, how to carry the baby. Correct. So today we are going to see how to bond with your baby very well and to do start with the baby massage. So when to start, so how to do a proper technique of baby massage for your newborn. Okay, so let's start with baby massage. So you all will be knowing about what is baby massage, right? So we have certain things about baby massage, right? So first thing we'll start about the benefits of baby massage. So what is the benefit of baby massage? So baby massage is nothing but it is a therapeutic technique which is being used on your baby. Okay. So therapeutic technique using your hands, you're going to perform the baby massage on your baby. Right? So these baby massage have certain benefits. So like psychological benefits, like physiological benefits, emotional benefits on your baby. So we will see some of the benefits. So what are all the benefits of massage? Okay. So first thing is the baby massage. Massage is going to be very gentle so that the baby emotionally feels that baby is very much calm. So it is being very much secured in your arms. Correct. So when the mother is lifting the baby, okay, the baby feels that it is very much secured. So this is the first benefit. Okay. The second thing is the baby has some physiological benefits. Okay. The baby has some of the primitive reflexes. So if you start doing baby massage, the primitive reflexes will be very well matured. The tone of the baby will increase a lot. Okay, because the baby is being very much newborn and the baby has to be like taken to the next step. So it has to develop. So there will be some developmental stages. Okay, like the baby has to roll over, the baby will sit. So for these things, the muscle has to support a lot. So for this developmental stages, baby massage helps you a lot. Okay. The next thing is the physiological benefit, like the baby sleeps nicely. The baby will be having some environmental disturbances in the initial stage. So when you start doing the baby massage, the baby has a very good sleep so that you will also be taking a good nap, right? Yes. So there are some psychological benefits if you start doing baby massage, especially for the dads, because the mom will be bonding very earlier with the babies, correct? Because mom is the first person who the baby will be in contact from the womb. So till she is delivering her baby, correct? But the dads has to be bonding with the baby as much as earlier through baby massage. So if you are going to do the baby massage, so you'll be having a proper bonding between your baby and yourself. Okay. So this is a very, very a good thing, okay, to bond with your baby. And how to bond with your baby? There are many more things. See, always when you are delivering your baby, you have to co-sleep with your baby. So that is very, very important. Okay. What is co-sleeping? Never allow your baby to lie down in a separate crib or bed. So always with the mother touch or else with your touch. So it is very, very good to have a good bondage between your baby. Okay. So the second thing is start breastfeeding in the initial stage. Yes, I know that. See, if I have seen many mothers, like they will be delivering it normally or C-section, correct? For a C-section procedure, the mom will take at least 1 day to recover and get up and sit in the bed, and they will be not lifting the baby for feeding, correct? So in these things, you have to start feeding. See, I know about the pain of a mother, but you have to start feeding your baby immediately. So the golden hour feed. So this will start bonding, like increase the bonding between you and your baby. Okay. So these are all the bonding techniques between your baby and yourself. And massage plays a very important role in bonding. Okay. Okay. So next thing is we'll be moving on to the ideal time of doing baby massage. Okay. What is the ideal time of doing baby massage? So you all know that baby massage soothes, correct? So now it is very it is summer season. So don't don't do the massage very much probing on your baby. Okay. So you should not do it like more than 15 or 20 minutes. Okay. So you have to be very much soft and gentle touch over your baby. So it should not be in the 12 o'clock in the noon. Okay. So the baby massage has to be done on the between 8 to 10 because this is summertime, or in the evenings between 4 to 6. So this is the ideal time to do in the summertime. Or else generally you can do it in the morning as well as in the evenings. Okay. Or else some people, they'll be following like before the bedtime also you can do the baby massage. Okay. So gently you can start doing the baby massage, and we have so many strokes to do, continue on the baby, and it will take like 15 to 20 minutes also. So you can take 15 to 20 minutes to gently finish the massaging technique. Okay. Fine. So we will see what are all the benefits of massaging. Okay. The benefits of massaging is some babies will be, newborn babies will be having colic pain. So you have learned the burping technique in the previous session. So now I'll be telling you many more techniques about to relieve the colic pain also. Okay. So if you are doing a special technique over the tummy, it will relieve the colic pain of your baby. First thing. The second thing is It improves the physiological benefits like sleep and increases blood circulation. And it will make your baby calm. It will make your baby to adapt with you and to the environment. Okay. So these are all the benefits of massaging. The baby's skin will become good, and new skin will be forming, and many more things are there. Fine. Okay. So, before getting into the massage, okay, preparing for a massage is very, very important before going into the massage. Okay. So, what is this preparing for a massage? Okay. So, you have to select the ideal temperature. First of all, the room temperature must be around 26 to 28 degrees Celsius. It should not be too much hot, or it should not be too cold, because you are going to do the baby massage after removing the dress of your baby, correct? So what you have to do is check for the environmental condition first, the temperature, okay? And never allow your baby to lie down on the table, okay? It is very, very important. So always put your baby down and start doing the baby massage, okay? That is very important, because never allow your baby unattended, okay? Next thing is the surface. Surface must be evenly surfaced. So that is like, you should not have a sharp objects in the ground, or else the surface should not be uneven, because your baby is going to lie on the mat, correct? So you can place a mat on the surface and put your baby over that, okay? So the next thing is, you have to be very much comfortable before starting a baby massage. Okay, so before starting a baby massage, what you have to be doing, you must be dressed properly. Your hands, like, you should not have any rings or watches, or check your nails before starting the baby massage. So you have to be perfectly positioned on the ground, so that you should not end up with back pain, correct? So you have to place everything in beforehand before starting the massages, okay? So what are the things you need for a baby massage? See, first thing is, you need a baby, correct? So I'm having my baby in my hand. So the next thing is, you are going to prepare the proper oil, correct? So the oil you will be prescribed with the pediatrician. That is, your pediatrician will prescribe a massage oil. So that one you can use it, okay? So put a soft towel on the ground, and you have to switch off the TV before you start doing the massage. So don't talk to anyone, okay? Because you should fully concentrate on your baby's massage, okay? And always have an eye-to-eye contact with your baby and start doing it, okay? This is very, very, very important. Fine. Okay. So the next thing is massage oil. So many parents have asked me about how to start with, what oil can I use? Okay, which one to use about? So you can use proper vitamin E oil, which has been prescribed from your pediatrician. Okay, don't use mustard oil or unrefined peanut oil, cream, eczema. So eczema is another condition where the babies have a red color patch over the skin. Okay. So in these conditions, you should avoid using these creams, fine? And the next one is coconut oil, okay? Coconut oil is a safe thing which you can use it, fine? Okay, so let's move on to the massaging techniques. Okay, what is the general instructions to follow before doing the massages, okay? See, always you have to start doing massage from your baby's foot. Okay, from the foot you have to start, and to the legs, and to the tummy, chest, hands, okay, then to the face, and then make the baby to lie on the chest, and then start doing the back massage, okay? Never change your baby's position often. So don't change your baby's position often. So doing the starting massage from your foot, and then moving on to the face, okay, and then moving on to the chest. So don't do it like this. So you have to be gently doing it, and you have to concentrate on which part you are going to do the massage. It's very important. So always go with the protocol. So first thing is legs. Second thing is calves. The next thing is thighs. And then see chest. And then the tummy, both hands, face, and then the back. Okay. So before going into the techniques, okay, you have to be first placed properly on the floor, correct? Because you are going to give your baby the proper massage. So what kind of a position you can adapt? See, better to sit on the floor and start doing the baby massage. And before that, you can stretch your legs like sidewards. And then you can place your baby in the center and start doing the massage, okay? And next thing is the like if the baby is very much like newborn, okay, what you can't put the baby in this position. So what you have to do is you can put the baby on your lap and then start doing it. Okay, so that is very, very important because the baby's head, the baby will not be getting the head control in the initial 3 months. So you can start doing it. Okay, so like putting your baby like this, turning the face towards the sides, and then you can start. This is for the babies who are less than 3 months. Okay. Next thing is you have to, before starting the massage, you have to check with the umbilical cord, whether the umbilical cord has been healed or not. Okay. Generally, usually the umbilical cord falls down within 11 days. Okay. Span of 11 days. So after your baby is born. So after the 11th day only, you have to start doing the maximum massage techniques over the baby. Before that, you can gently massage the legs and the face and the hands. Okay. So never do a strong massage technique over the tummy because the umbilical cord point will not be healed. Okay, so it will take its own time to get healed. So you have to see to it that there is any bleeding over the tummy, or else if the wound is not healed properly, so you have to be very much careful about that point. Okay, so the next we will be moving on to the massage techniques. Okay. Okay, see, we have certain techniques to be followed over the leg and feet. Okay, so first thing is, see, we are going to do toe hugs. Okay, so gently touch the oil, and it should not be too much slippery over your hands. Okay, or else you will be losing your grip over your baby. So just touch it, and to avoid friction, you are going to use oil. Okay. So don't put more of oil over the baby, and it will be too much slippery and you can't even handle your baby very well. Okay, be cautious before starting the massage. Okay, the first thing you're going to do the technique is the thumb over thumb technique over the foot. Okay, so first use your thumb. See, move it from the foot. So this is the heel. Okay, from here you're going to gently move over your foot like this. So you're going to move it in the upward direction. Okay. So this is called as thumb over thumb. Next technique is the toe hugs. Okay. See, gently you have to move because the baby's fingers are closed. It is a reflex. Okay. You should not open the fingers abruptly. So you have to slowly open the baby's finger. Open up and then close it. Open up and close. Open up and close. So slowly you can do it, or simultaneously you can do the 5 fingers open up and closing it. Okay. The next thing is ankle circles. Okay. There are 2 prominences over the baby's foot. One is the medial malleolus, one is the lateral malleolus. So you have to use your thumb over the malleolus. Gently do the circles like this. Can you see it? Yes. So gently you can do the circles over the baby's foot. Okay. So next one is the Swedish milking and Indian milking. Okay. Swedish milking is nothing but you're going to use your web space. So you're going to use your web space and you're going to hold the baby's legs like this. And you're going to pull it towards the baby. So towards the baby, you're moving it. So that is called as Swedish milking. Away from the baby, if you're moving it, it is called as the Indian milking. Okay. So you all understood, I think. So there are 5 techniques over the feet and the legs, the total legs. Okay. One is the over the feet, you're going to do 2 techniques. That is, see, in the sole of the foot, you're going to do thumb over thumb. You're going to do toe hugs. That is, bend and open up and close the fingers of the baby's foot. Okay. Next thing is ankle circles. You're going to move it like gentle circles over the medial and lateral prominences of the foot. Okay. Next one is Swedish milking. The Swedish milking is nothing but you are moving the massage towards the baby, and Indian milking is away from the baby. So towards the baby, you're going to move, that is the Swedish, and away from the, see, away from it is the Indian milk. Okay. So this is the gentle massage techniques over the feet and the legs. Okay. Then the next thing is we will be moving on to we have completed the legs. So next is chest. Okay. Over the chest, we have 2 techniques. One is the open book. One is the butterfly. Okay, what is open book? See, we have to gently open up the chest of baby like this. See, gently move it away from the midsection. So this is the area where the important organs, the lungs, the heart, and the rib cage, that is the thoracic cage, okay, that lies over the chest part. So you have to be very careful when you're applying pressure over the baby. So what you will be doing is gently apply pressure over your eyes. Close your eyes, gently apply pressure over your eyes. So this much pressure only you have to apply over the parts of the baby's body. Okay, because the rib cages are very, very, very mature, because the bones are very much fragile, because it is a newborn baby, right? So you have to start doing very slightly, don't apply more of pressure over the chest. Okay, so gently move it from the midsection to the sideward like this. Okay, see, like this you have to move it. Okay, the next thing is butterfly. So what is butterfly technique? See, from the lower segment of the rib cage, you are going to move it towards the neck. That is the collarbone of the baby. Okay, from here to the opposite side, from the left to the right opposite. Okay, so gently you can move it frequently like this. See. Okay, so move it like this. Fine. So this is the massage 2 technique which is being performed over the chest. So next thing we'll be moving on to the tummy. Tummy is very, very important. Correct? So tummy we have 3 techniques. Okay. So I previously told you about the colic pain. So mostly like bottle fed babies or due to some circumstances you will be using bottle feeding for the baby. Correct? So for these babies, there will be more of colic pain. And if you don't burp your baby properly, the baby will be developing colic pain. So for this, especially this I love you technique is very much useful, because this I love you technique is towards the large intestine. Correct? See, there is small intestine and large intestine in your baby's gut. So you are moving massage this I love you technique in the place of the large intestine. Correct? So first thing is up. Next thing is you have to slide towards the left and then towards down. So this is I, this is L, and this is U. So U. So this kind of a technique about around the umbilical cord. That is the umbilicus point. You have to stroke it gently. Okay, this is called an I love you massage. And every strokes you can repeat it for 10 to 15 times. Okay. So next technique over the tummy is, see, you can use your full hand. So move it from up to down like this. See, this is the gentle movement over the tummy. Okay. So you have to do this. Okay. So this is the hand over hand technique. Okay. The next one is, this is the umbilicus and we are going to surround it with the circular motion. like this. So this is called as sun-moon technique. Okay, this is called as sun-moon technique. So we have three techniques over the tummy. One is the I love you technique, one is sun-moon technique, one is hand over hand technique. Okay. So now we have finished legs, feet, chest, and the tummy. Okay, now we are moving on to the hand. So while moving on to the hand, what we are going to do is, see, the same thing. So open up the fingers and close it. So this is one of the technique which we followed over the foot. The next one is wrist circle. So you are going to circle over the wrist. Okay, this is the next technique. Fine. Next one is you are going to do the Swedish and Indian milking. So you are going to hold the baby's hand like this and see, move it towards the baby. This is Swedish milking. Away from the baby, it is called as the Indian milking. Okay. It is very, very essential to move it gently over the hands. Don't never pull out the baby's hand out of the shoulder. Okay. Okay, fine. So we had three techniques over the, four techniques over the hands. So that is one is Swedish, Indian milking, and then gently wrist circles and opening and closing of the fingers of the hand. Okay. So the next thing is we are moving on to the face. Okay. See, face is very, very, very important area because we have openings like ears, eyes, nose, correct? So these openings should not get oil inside because there are chances for the babies to get aspirated, and never put oil in the eyes. Okay. So you have done the massage over the rest of the bodies. With the same hand, you can start doing the massage for the face. Okay, that oil is enough for the face. Okay. See, always follow that. See, there will be some practices at your home. Okay. Doing head massages, doing face massages, pulling out the nose and stabbing on baby's chest. So these are all wrong practice. So never follow it. And always during the bathing time, the elderly people will be blowing the nose of the baby to pull out all the secretions from the nose of the baby. Okay, that is very, very, very wrong practice. Okay, you should not do that, and never pull your baby's nose too hardly. Okay, I have seen people who are pulling the baby's nose like this because the nose will be becoming sharper. So never do that. Okay, because it is a small cartilage which is not yet developed for a newborn baby. Okay, so never do that. And never put oil in the nose or ears or in the eyes. Okay, it is very, very essential to take care of it. And one more thing, you have to concentrate when applying oil over the baby's head. So there are two openings in the head. Okay, initially this is called as anterior fontanel. This is called as the posterior fontanel. So be careful, never apply too much pressure while massaging baby's head on the anterior and posterior fontanel. Okay, so while doing the face massage, you have to use only three techniques. That is, see, one is around the eyes like this. Gently do a circular motion over the baby's eyes like this. And one is the upper lip and other one is the lower lip. Okay, so gently pull out the baby's lips like this. 1 and 2. 1 and 2. Okay. So these are all the technique over the face. Yes. So previous class, they told you like how to handle the baby, how to lift and keep your baby in your arms. So the same way, you have to learn the position, how to turn down your baby, correct? So first thing, you have finished all the massages over the front part of your baby, correct? So now you have to gently lift the baby. See, hold your hands over the baby's chest and head like this. And slowly turn over the baby like this. And move your baby's head towards a side, towards left or the right side. So like this only the baby has to lie down when you are going to do the massage over the back of the baby. Okay, very, very, very important. Okay. So the next techniques we are going to follow is three techniques we have. One is the swoop One is the back and forth technique. One is the circles over the baby. Okay. See, this is also a very sensitive part where we have spine of the baby, correct? So never apply too much of pressure over the baby's back. Okay, because all the nervous system are still being developing for a newborn baby. Okay. So gently, first use both your hands. See, this is called a swoop technique. Gently move it. One hand towards the head, another hand towards the bum. Okay, so like this you have to move it. This is called a swoop technique. Okay. The next one is back and forth. So what you're going to do is back and forth. Move your hands back and forward like this over the back of the baby. Next one is the circular movement. So use your palm of your fingers and then do gentle circles over the baby's back like this. Okay. So this is the three techniques which we use over the baby's back. Okay. So let me come from the first. Okay. So see, concentrate. Okay. Very important techniques from the legs. I'll be moving on one more time. On the feet, we have three techniques. One is thumb over thumb. One is the open and closing of the finger. Okay. So next thing is the circles. That is the ankle circles. Okay, gently you're going to move it like this. See, ankle circles is very, very important. You have to move it over the malleolus. See, like this you're going to do. Okay. The next one is the, see, Swedish and Indian milking. You're going to hold your baby like this. You're going to move it towards and away. So towards is called as the Swedish. Away is called as the Indian milking, right? Okay. The next thing we are moving on to the chest. So chest, we have two techniques. One is the open book. One is the butterfly stroke. Open book and the butterfly. See, squeeze. See, take it and do this. See, both the sides you can do alternatively. Correct? So like this you can do it. Okay. The next is, see, over the tummy we have three techniques. One is I love you. Okay. One is the, see, sun moon technique. One is the hand over hand, like this. Okay. Hand over hand technique. Okay. The next is, we are moving on to the hands. Okay. Opening and closing of the fingers. Wrist circles. Like this. Okay. Swedish milking. And again, Indian milking. See, this is called as the Indian milking. This is the Swedish. Swedish is towards the baby. Indian is away from the baby. Okay. The next one is over the face. See, you're going to move it like this. See, gently, I'm just putting pressure, less pressure over the eyes. Okay. Next one is the, see, pull out. See, pull out. Next one is lower lip pull out. Okay, like this. Fine. The next thing is over the back, we have three more techniques. So what it is? One is circles. Okay. Next is back and forth. Okay. Next thing is swoop. So this is, these are all the techniques which we use it. Okay. Fine. So ideal time, I have told you that never do it in the 12 noon without any, addition inside your room, because it's too much now. It's summer actually. So actually gently do the massage in the early morning or it's in the evenings, and continue your massage for 15 to 20 minutes and see to it that if your baby is not cooperating well, if your baby is very much fussy and the baby is not cooperating for you for the massage, please don't do. Okay. If always you have to go through your baby. Okay. You have to be having proper eye-to-eye contact with your baby. So what your baby is reciprocating to you, you have to do the same. Okay. So this is very, very, very important. And after feeding and before feeding time, you have to be very much careful, because immediately after feeding, you should not go for baby massage. And it must be like 30 minutes before or 30 minutes after. Okay. Because the baby will end up with indigestion. So the blood circulation will be all over the baby's part for the baby massage. So you have to be very careful. Okay. So that's all for today's session. And if you have any doubts, you can, you can post it in the chat box so that we can answer you. Okay. So thank you once again for this wonderful session. Thank you.